Good day, everyone. You're welcome to my YouTube channel, Everything Medical. On today's video, I'll be treating the anatomy of the anatomical snuff box. It can be called the radial fossa. It's one of those vital space in the upper extremities of the body. Without wasting much of our time, let's dive into the class properly. The first thing to note about this topic that is a space. You get? That is the first thing to note that it is a space. Okay. Now, introduction. Okay, what is anatomical snuff box? Anatomical snuff box can be called the radial fossa. It is an elongated triangular depression. Elongated triangular depression that is situated at the lateral aspect of the dorsum of the hand. It is an elongated triangular depression that is situated at the lateral side or the lateral aspect of the dorsum of the hand. It is located at the level of the carpal bones. This fossa or the depression is prominent when the thumb is hyperextended or extension of the thumb. That is when you can see it clearly. You could see the tendinous boundaries around it because the boundaries of it is not by the muscle, it is by the tendons of the muscles. That is the first thing to note about this space, that it is not the muscle that form the boundary, it is the tendons of the muscle that forms its boundaries, not the actual muscle itself. Okay, that is the introduction. The next is the boundaries. So this diagram depicts the boundary of the anatomical snuff box. So we have the boundaries of anatomical snuff box. Boundaries. Boundaries. Okay. The radial fossa, which is the anatomical snuff box, has the following boundaries. It has one, the posteromedial boundary, which can be called the medial or the ulnar boundary. Posteromedial boundary. Number two, it has the anterolateral boundary, which can be called the radial boundary or the radius boundary per se. Anterolateral boundary, which can be called the radial boundary, while the posteromedial boundary can be called the ulnar boundary. Number three boundary it has is the proximal boundary. The proximal boundary. Yes, it is a space, so it must have a roof, which is the covering, and the floor. It have a roof, and lastly, the floor. Okay, let's start with the first boundary, which is the posteromedial boundary. What are the structure, or what is the structure that form the posteromedial boundary of the anatomical snuff box? It is the tendon of extensor pollicis longus. The tendon of extensor pollicis longus. Tendon of extensor So this is the tendon of the muscle that forms the posteromedial or the ulnar boundary of the anatomical snuff box. Okay, we go to the next one, which is the anterolateral boundary. The anterolateral boundary is formed by two major tendinous muscles. Number one is the tendon of extensor pollicis brevis and tendon of abductor pollicis longus. The first tendon here is the tendon of extensor pollicis brevis. While the second tendon, way down here, is the tendon of abductor pollicis longus. I said previously that it is not the muscles, these muscles that forms this boundary. It's actually the tendons of the muscles that forms the boundary. And that was hyoid. Okay, the proximal boundary is actually formed by the styloid process of the radius. That is what that forms its proximal boundary. Okay, now let's delve into the roof. It's a space, it must have a roof and a floor. A roof is something that covers it, that overlies it. We all know that in a space, the structures that forms the roof is the skin and the superficial fascia. So we have the skin and superficial fascia. Okay, now the floor. The floor is what that forms underneath it. The floor of the anatomical snub box is formed majorly by the scaphoid bone. As you can see, the S written here, it is the scaphoid. And scaphoid bone is the most common carpal bone that is prone to fracture. Scaphoid bone. It is the commonest carpal bone that is susceptible or prone to fracture. The next bone that could associate with the floor is the trapezium bone, the trapezium. So we have the scaphoid and trapezium. Okay, so these are the tendons that forms the boundaries of the anatomical snub box, while the skin, the superficial fascia form the roof, the scaphoid and the trapezium forms the floor. Okay, the next we're going to be looking at is the content, because a space must have a content. So we have the content. The number one content of the anatomical snub box is the radial artery. The number two is the superficial branch of the radial nerve. Superficial branch of radial nerve. Number three is the cephalic vein. The cephalic vein. The radial artery is one of the peripheral arteries for pulsation. Firstly, the radial artery pulsation can be felt at the region of the distal wrist. It can also be felt occasionally at the region of the anatomical snuff box, precisely the proximal portion of the anatomical snuff box. Recall that the radial artery courses along or crosses the anatomical snuff box and passes between the head of the tendon of abductor pollicis longus muscle, where it is being felt to check the cardiac pulsation. The superficial branch of radial nerve are found on the skin and subcutaneous tissue around the anatomical snuff box. Okay. Now, the cephalic vein arises from the dorsal venous network of the hand. It crosses the anatomical snuff box and enters the forearm, particularly at the anterolateral aspect of the forearm. Okay. Recall that the cephalic vein is one of those choice of intravenous vein infusion or intravenous fluid infusion at the region of the anatomical snuff box. It has a clinical relevance. So these are the contents of the anatomical snuff box. The next in line we're going to be discussing is the clinical relevance of the anatomical snuff box. Clinical relevance. Okay, here is our radial artery. Radial artery. While this is our first metacarpal bone. Metacarpal bone. Okay, the first clinical correlation of the radial fossa, which can be called the anatomical snuff box, is the radial artery pulsation, which can be felt at the proximal portion of the anatomical snuff box. Number one, radial artery pulsation, which can be felt at the proximal aspect of the anatomical snuff box. Then number two is the cephalic vein. The cephalic vein is a choice of vein for intravenous fluid infusion. That is the second clinical relevance of the anatomical snuff box. The number three includes the tenderness at the anatomical snuff box indicates the fracture of the scaphoid bone. Because when the scaphoid bone fractures, it presents clinically tenderness at the region of the anatomical snuff box. Okay, the number four clinical relevance is the fracture of the scaphoid bone. The scaphoid bone, as I've said previously, is the most commonest carpal bones to be fractured. And what causes the fracture? It is a fall from an outstretched hand, that is FOOH, fosh. Fall of an outstretched hand. Fall of outstretched hand. So this is the mnemonic to remember what that causes the fracture of the scaphoid bone. You get fall of outstretched hand. Okay, the fracture of the scaphoid bone could indicate or could cause what we call avascular necrosis, because when there's fracture of the scaphoid bone, it leads to retrograde blood supply at the region of the what? The anatomical snuff box, because the radial artery is lesioned. It will lead to what? Avascular necrosis, thereby causing retrograde blood supply at the region of the anatomical snuff box. To tell you that scaphoid bone is very, very important, is of clinical relevance because of the clinical dysfunction that arises when it got what? Fractured. Now, there is a certain clinical relevance that could take place as a result of fracture of the scaphoid bone. Missing fracture of the scaphoid bone could lead to osteoarthritis as the patient ages, because there could be inflammation at the region of the scaphoid bone region. That is the joint that join the bones together at the region of the what? The carpal bones. That could be implication of osteoarthritis as the patient ages. So those are the clinical correlation that happens in the anatomical snuff box. I believe we have done justice to this topic. It's a very, very important topic in the upper extremities. That is the lateral aspect of the dorsum of the hand. Do well to watch this topic to the end. I believe you enjoyed it. Share your friends in medical school and endeavor to subscribe to my YouTube channel and anticipate for more videos on anatomy. Thank you so much for watching.